We begin with some breaking news just coming in the last hour or so. Buckingham Palace says Britain's Queen Elizabeth is under medical supervision after her doctors reported, quote, concern for her health. The statement says the Queen is in a comfortable state, although Buckingham Palace rarely comments on her health. The exact concerns have not been disclosed. Prince Charles, who's the heir to the throne, is reported to be with the Queen, and other members of the royal family are travelling to her estate in Scotland. Well, let's cross over straight to London now, where DW's Birgit Maas is standing by. Birgit, what more can you tell us?
It's really a developing situation, Rebecca. We have this official statement that the Queen is not well, and as you said, that is quite unusual. I have not heard the palace commenting much on the Queen's health, and never with anything so serious. So we know that the Queen has not been in great health of late. Many of her engagements that she was always, during her whole lifetime, so eager to attend in person and that she so dutifully attended, many of those have lately been virtual, so she wasn't really able to go places very much. And Liz Truss, the Prime Minister, was meeting the Queen only 2 days ago, and usually that would happen in Buckingham Palace, but the Liz Truss and also the outgoing Prime Minister Boris Johnson, they had to travel up to Scotland to meet the Queen because she had, as it was then said, mobility issues. So we don't really know what the problem is and in what way her situation has deteriorated, but something must have happened, because otherwise the children and grandchildren, now it's being reported that also Harry and Meghan are on their way to Scotland, otherwise all this family wouldn't travel up to see the Queen.
Yes, certainly. In that statement, phrases such as medical supervision, cause for concern, it certainly does sound very serious, right? And different to what that they don't normally comment on her health, as you say.
That's right. When she contracted COVID, there was already a bit of a shock going through the country, and people were waiting their breath and hoping that she would recover. That was just this one statement that she had COVID, but that she was doing fairly well. And then she has recovered from that, from all we know, but not very many public appearances by her. She was surprisingly opening up the Elizabeth line. It's a big new project in London that was obviously named after her. So that was delighting many British people that she was there, but nobody had been expecting that. That happened this summer. So very recently she has had very low-key engagements and mostly virtual.
Now, as you mentioned, we know that the Queen's health hasn't been great of late, but as you also mentioned, we saw photos of her just on Tuesday accepting the resignation of outgoing Prime Minister Boris Johnson, as well as appointing the new Prime Minister Liz Truss. So she still has been managing to carry out some official duties in the last few days.
Yes, very much so. And these pictures that have emerged from these meetings show her smiling and welcoming Liz Truss as the new Prime Minister. And also she was able to meet Boris Johnson. So we know that above anything, she's known for her sense of duty, and she would have most likely liked to go to Buckingham Palace and meet those outgoing and incoming prime ministers there, but it wasn't possible. But it really speaks for this sense that she has to stick it through, that she, even with her ongoing issues, she was seen on a walking stick, that she managed to meet these two prime ministers, and that she is really determined she was really determined to continue working as much as she could.
All right, Birgit, thank you very much. DW's Birgit Maas in London. And with me in the studio is DW reporter Alex Forrest-Whiting. Alex, we just heard from Birgit there, but just for people just joining us and just so that we have everything together, summarise for us what we know so far.
Well, we know that the Queen, who has been Queen for 70 years, she rose to the throne in 1952. We know that she is unwell. so unwell that Buckingham Palace has issued a statement about that, saying that her doctors are concerned for her health at the moment, but we don't have any more detail about the situation of her health. What we do know is that members of her family, some are already at Balmoral, that's in the north of Scotland where the Queen currently is. Some are with her, for example, Prince Charles and his wife Camilla, and others are travelling there. So, for example, Prince Edward, Prince Andrew, two of her sons are travelling there, and also Prince William. And we also hear that Prince Harry and his wife Meghan are also travelling to Balmoral. So that in itself says that this is a very serious situation by the fact that members of the family are gathering in the north of Scotland to be by her bedside, and also the Buckingham Palace has made this statement saying that doctors have said they are very concerned about her health. We do also know, of course, that the Queen has had serious mobility problems in the past couple of years, at least. That has been said. That means that we have not seen her as much in public as we have done in the past, but she has still very much tried to carry out her public duties, which is what Birgit Maas was saying there, you know, that sense of duty. Yeah. Which I think has been so key to Queen Elizabeth's rule over these 70 years, that she has always tried to carry out her sense of duty, and nothing can stop her from doing that, not even when her own husband, Prince Philip, died last year. She carried on.
Absolutely, and we saw on Tuesday, of course, you know, she can't have been feeling all that well either, and yet she did, you know, want to, as Birgit said, you know, it was very important to her that she carry out the duties of accepting the resignation of Boris Johnson and then appointing Liz Truss. Talk us through some of the immediate reactions that this news is triggering.
Well, we already know that Liz Truss, who is the new Prime Minister, has said that she is very worried. And we know that other politicians have said the same in the UK. We know that the Archbishop of Canterbury, who is, he's not the head of the Church of England because that's actually the Queen, but he has also said that he is praying, that the whole Church of England is praying for the Queen. And there are also messages coming in from across the world. So I think people are very, very worried. I mean, you have to understand that the Queen is not just the Queen of the United Kingdom. She's also, as you said, the head of state of 14 other countries, including Australia, including Canada, and 12 others. So this is a very, very important moment for the world and for many countries as well. And as I said, you know, she has been Queen for 70 years. She celebrated her Platinum Jubilee earlier this year. It is a milestone. She's 96 years old. She has been taking a step back over the past year or two.
Quite understandably.
Quite understandably. Her own son, Prince Charles, for example, was at the state opening of Parliament this year. That the picture we have on the wall behind us, that's the Queen at the state opening of Parliament in London, so in the House of Lords, where she wasn't there this year. Prince Charles had to do it. So he has already been stepping up to take on some of the roles that she would have done in previous times, as has her grandson, Prince William. So, you know, everybody has been trying to do their bit, back her up as much as possible. But, as we keep saying, the Queen has always tried to do her, carry out her sense of duty, carry on, particularly this week. It's been a massive week in British politics, saying goodbye to Boris Johnson, who I think was her 15th Prime Minister, and welcoming, I think, her 16th Prime Minister, Liz Truss. But yesterday she was supposed to have a meeting with very senior ministers, the so-called Privy Council. That was cancelled, so I think that was an immediate warning of perhaps the Queen is not particularly well at the moment because, again, that's not something that she likes to do. And then this announcement today from Buckingham Palace that doctors are concerned for her health. And
also the fact that she's in Balmoral and not in Buckingham Palace, yes, perhaps that says something as well. It does,
because she would, of course, always be in Buckingham Palace to welcome a new Prime Minister. The last 15 or so Prime Ministers, but she was unable, it appears, to get back to London, so she stayed in the north of Scotland. That is her summer residence, but it is unprecedented that she would be up there. So, again, that was another indication on such a big political week in the United Kingdom that the Queen was up in the north of Scotland and not down in London, so that that she could welcome in the new Prime Minister, Liz Truss.
All right, Alex, we'll, of course, be following this story throughout the evening and the coming days. Thanks very much for that update, Alex Forrest Whiting.